everyone. I just wanted to give some general advice. Sorry about the background noise. There's some cars coming back and forth. Essentially, I just want to say to first and second year medical students, try your very best to study very well for the step 1 exam, because that's actually going to help you when you're studying for step 2. I found that students who have done really well on step 1 tend to not have to study as hard for step 2 because they already can figure out the diagnoses pretty quick. And the thing about step 2 is that it tests your ability to figure out what the next best step in management is for the most part. So what kind of imaging would you order? What kind of diagnostic studies in general would you order? What would be the next best treatment option? And yes, this sounds simple, but it can actually get quite complicated, especially when there are multiple different next steps in management. In real life, for example, your hospital could have a different next best step in management in comparison to another hospital, in comparison to what you learn in UWorld. And even in general, they might not even be using certain drugs in real life, but they want you to know that as the next best step in management on the shelf exam or for step 2. For example, TCAs for psychiatric disorders. I did my psychiatry rotation. They were like, we have never used that and haven't used that in many years because it has so many negative effects like cardiotoxicity, etc., etc. So that was typically avoided. But again, you have to know that as the next best step for certain conditions. Another thing that I've noticed is that UWorld is not enough for the shelf exams. UWorld is enough to pass the shelf exams for the most part, at least. Again, it depends on how strong your background is, how well you did on step 1. That can also help determine how well you're going to do on the shelf exams, to be quite honest. But I find that UWorld is just not enough. You need another resource typically when studying for shelf exams. Of course, if you just want to pass or even borderline pass, UWorld might be enough. Some people get high passing marks with just UWorld. Again, it depends on you, but I still find that a lot of times you need another supplemental resource, and that's why a lot of medical students recommend different books and first aid for step 2 or master the boards or case files for certain rotations or Pastanas for surgery, the Virgilios, Anki, Quizlet. Unfortunately, UWorld is not all encompassing, so that's why I'm making videos about the different shelf exams and sharing some of the resources that I used for them or that other students recommended and found to be quite useful, just so you guys know that, hey, these are the resources that I could use for these shelf exams, so you're not completely lost and you don't depend on just UWorld. Sometimes UWorld is enough. Like for psychiatry, I felt like it was just enough, but it's still nice to have those backup resources just in case.